Well, Senator Max Baucus' health care bill faces its first big test in Congress. This week, members of the Senate Finance Committee will begin offering their changes to the plan. For more on where the legislation goes next, Bloomberg's Peter Cook is here in New York with the number 2 Democrat in the U.S. Senate. Peter?
Betty, thanks very much. I'm joined by the Assistant Majority Leader of the U.S. Senate, Dick Durbin of Illinois. He's the man responsible for rounding up the 60 votes needed to pass a health care bill. He joins me here in New York. Senator, good to see you. Thanks for the time today. And
thanks, Peter.
60 votes, a daunting prospect for any piece of legislation. I want to get your sense about the Baucus bill as it begins the markup in the Finance Committee. Is this a bill you and other Democrats are going to be able to rally behind?
I can tell you Max worked hard, spent a long time sitting down with key Republicans to try to make it bipartisan. It may ultimately be. I hope it is. And it's a good starting point. I think when you get down to particulars, many of us have questions and concerns, but we want to keep this process moving forward. Ultimately, it's going to go through 3 or 4 hurdles before it finally is considered for final passage. I think the first test may come as soon as a week, 2 weeks, when we have a floor vote to see if there are 60 votes there.
A floor vote, you expect the Finance Committee to wrap up its work and then this is coming to the floor sooner rather than later?
Well, it may be wishful thinking. You know, there are hundreds of amendments there in finance, but the hope is that they can finish the work this week and that then the beginning of next week, Harry Reid, the Majority Leader, will sit down with Max Baucus as well as Chris Dodd of the Help Committee, try to blend together a bill which we can find 60 votes for on the floor.
Let me ask you about the Baucus bill itself. If it made it to the floor in its current form, as Chairman Baucus has drawn it up, we understand it may undergo some changes. Could you vote for it?
I could do it with the understanding that it isn't the final work product. There are several elements there that concern me greatly, not the least of which is affordability. As Democrats, and I hope even Republicans, feel that whatever we're going to do here ultimately has to be affordable for most of the families across America, and that means a helping hand for some in lower income situations. I don't think the Baucus bill goes far enough. Now, the other side of that equation is, because it doesn't have the major subsidies for families and low-income taxpayers, it's going to be a less costly bill and is not going to add to the deficit. So that's really the tension that we have on the affordability question.
Have you given up any possibility that this bill, when it does reach the floor, that it's going to have a public option?
You know, I support a public option. I want the bill to include it. I think it's problematic as to whether it will, particularly with any Republican support. But we want to do our best to move to the point where we hold the health insurance companies accountable. So there's real competition in markets so that we can keep costs down so that businesses and family have the peace of mind that it's not going to grow out of control.
What about this idea of taxing Cadillac health insurance plans, taxing the insurers, this excise tax of 35%, that's in the Baucus plan, this idea of essentially getting these health insurance companies to pay this bill, this tab for these high-priced plans? What do you make of that and the notion, the criticism that it's a backdoor tax on Americans? It's just going to be passed on to Americans.
I can tell you, when you read about Goldman Sachs managing directors' health insurance premiums, $40,000 a year, I can't imagine what they're buying for $40,000. That is truly a Cadillac, maybe even a BMW or Mercedes, I'm not sure. But one man's Cadillac, as the New York Times said this morning in a headline, is another man's Chevy. Some of the plans, the group plans for smaller groups in smaller markets, can be extremely expensive for the same benefit package that I enjoy as a part of the federal employees' health benefit plan for a much lower cost. This is something we're going to have to balance out. We want to have a disincentive for overextending in health protection with the tax exclusion, and we also want to make sure we have basic coverage. It is a tough balancing act.
All right, you mentioned Goldman Sachs. That gets me to another topic I want to bring up with you, and that is financial regulatory reform. It's taken a back seat, if you will, to the health care fight. Do you all anticipate in the Senate having floor time and getting a bill passed this year?
Yes. Chris Dodd's decision to stay on the Banking Committee was a signal that he's going to take this seriously. And I think that he's going to work in a parallel timetable with our work on the floor on health care to move financial regulatory reform. And I think it's essential. If we've learned any lessons from the Great Recession, let's apply those lessons to changing the law to avoid having this happening again.
What about the debate that's been playing out, and it's going to happen with the president this week at Pittsburgh at the G20, about executive compensation in the financial sector? How far should the government go to limit executive compensation? Do you think bonuses should be banned?
I think there ought to be more accountability. I think the shareholders ought to be involved in the vote. I think there ought to be full disclosure. Some of the things that have happened are just inexcusable. These multi-million-dollar bonuses as a company's going down the chutes. How do you explain that? That isn't a meritocracy. That's some sort of a aristocracy as far as as I'm concerned. We need to have some accountability and transparency, make sure the shareholders have a voice in this process.
One quick political question before I let you go. President Obama apparently weighed in here in New York. Governor Patterson, the Obama administration suggesting maybe he shouldn't run for re-election. Is that appropriate for the president to do that?
Well, of course, we have a national party and a national election coming up in a little over a year, and we want to increase our chances for success. And I know the White House is taking a look state by state to improve their chances. Governor Patterson will have to make his own decision.
All right. Dick Durbin, he's the #2 Democrat in the U.S. Senate. Thanks for joining us here on Bloomberg.
Thank you.
Betty, we'll send it back to you.
Okay, Peter, thank you very much.